Welcome, and thank you for watching this presentation of the Center for Natural and Integrative Medicine. Today's presentation is titled Men's Health and the Alternative Approach. Your host for this presentation is Dr. Amar Kalidas. Dr. Kalidas is board certified by the American Board of Osteopathic Family Physicians. He earned his doctorate of osteopathic medicine degree at Nova Southeastern in 2010. Dr. Amar is a member of the Florida Osteopathic Medical Association as a family practice physician. For more information on this subject and other DVDs available from the Center for Natural and Integrative Medicine, contact us weekdays during normal business hours at 407-355-9246.
Hello, my name is Dr. Amar Kalidas, DO. I'm a doctor at the Center for Natural and Integrative Medicine. Today's talk is on men's health and wellness, and today we're going to look at different components and the main issues in men's health and disease. And what we'll be looking at is what are the natural cures, what are some of the other alternative strategies we can use to help get you feeling better.
Okay, so welcome to our office. We're starting the series for the 2014. I'm Dr. Kalidas, again, Junior Kalidas. I'm Dr. A. Kalidas, Kalidas. And Dr. Macheski and Dr. Stephanie K. A lot of people ask, how long we've been in this area, just to give a little background. I started my practice in this location about 14 years ago, and over the years, from 1,700 square foot office, we've grown to 7,500. Mm-hmm. And behind every successful doctor is usually someone that kind of prods them on and supports them. And I want to thank my wife Anita for doing that. And she's helped, the practice reach this point where we have multiple practitioners and continue to support me in my path. The first 11 years of my career, I was an internist, very busy hospital, and outpatient-based practice near the airport area. And I soon realized that there were a lot of shortcomings within the general medical area, and then decided to go to the naturopathic side. And from 1998 to 2000, I was in Portland, Oregon, did my training as a naturopath. And then coming back to Orlando, I felt I took us 5 years to kind of step backwards because Orlando wasn't embracing the holistic arena at that point. So I was one of the few physicians that started the practice back in 2000. And since then, the practice has really evolved and grown. And our focus is more on chronic fatigue, fibromyalgia, men's health. And we're also fortunate to be blessed with some, well-experienced and well-credentialed physicians who have joined us over the years. And Mike Kehoe is not here. He's a PA that's focusing mainly on chronic fatigue, chronic mold issues, chronic Lyme. Unfortunately, he had a social obligation in looking after the little one tonight, so he's caught up with that. But the other practitioner that joined us more than just about 2 years ago is Dr. Macheski, and he'll talk about his background. Yes, yeah.
I was practiced at Dr. Kalidas. We all have had an epiphany. We practiced as an OBGYN in Fort Walton Beach, Destin, Florida for many years, delivering babies, surgery, the typical OB. I really got heavily into hormones in the late 90s, and bioidenticals were not really, that was before Suzanne Summers and before the others. So I got in the ground floor kind of in a makeshift way, and then information came. I went back to do 2 fellowships in metabolic endocrinology and anti-aging medicine, so I refined my knowledge and honed it in on that. So like anything, where I was practicing there, there was great resistance. I was a lone wolf in the panhandle of Florida for hormones. And Dr. Kalidas was looking for someone that had some expertise, so to say, in hormones, and one thing led to another.
Again, he's brought the area regarding fine-tuning and especially for women's hormone and health. And in fact, men are coming to the office because of him as well, because women start feeling better, and they said, how come you're feeling better? I'm not feeling well. So a lot of the times, men will come and see Dr. Macheski or Dr. Amar as well. Stephanie, you want to spend a minute or two about your background and what you do? Yeah.
Sure, I'd be happy to. My name is Stephanie Kazicki. I'm an acupuncture physician and a doctor of oriental medicine. So I have 2 main functions here at this office. one. I am the acupuncturist. So I see a lot of folks with stress, anxiety, chronic pain, things like that. Also, I run the Zyto biocommunication scans, which is a biofeedback device that helps to not diagnose, but help to determine what supplements, vitamins, minerals, and herbs can be useful for a person in their protocol. That's about it.
Now the rest of the practice, again, Anita is a certified clinical nutritionist, and she does advise on diet as well. So that's an additional service we provide. And without a team support, I just want to introduce some of our staff members. Nikki. Nikki is both MA, and she's my right hand. She does all my work with my patient care and coordination. Jen and Natalie on the administrative and also on the supplement side. Jen likes to do the famous wave here. So, all right, then Angel, he does more the office, office front desk and stuff like that. And Bruni, who does the administration and also the organization for the meetings. So I want to thank her. Some of the talks we gave last year, we put it on DVD as well. So some gluten sensitivity, breast cancer, libido issues, GI issues. So these are available for purchase as well. We're basically passing the cost of the putting up the whole event, at least the cost of recording it, etc., to our patients. Next month we'll be talking about is stress killing you, and there's a new physician that's joining us, Dr. Romy Mustak. She is actually a neurologist, but her interest lies in life coaching and how the mind-body plays a role in terms of wellness. And she's become a keynote speaker at quite a few events, including she's been invited in Tampa, Florida Hospital, different parts of the country inviting her because of her ability to present it from a medical as well as from a life coach standpoint. So she'll be talking about the event on February the 20th. We also have ongoing yoga and some words of peace that's on the Sunday, every other Sunday of the month. A little background on Amar. I know him for a long time, being a dad, so okay. But to me, he had interest in medicine and went to Emory as an undergrad, and then went to Nova. He told me he wanted to go to a DO school. I said, why a DO? He said, well, it resonates more with what you do in the office. Because the DOs tend to be more family practice. They tend to care for the whole person and also use some of the skills as osteopaths. They do soft tissue adjustments, etc. So we supported his choices. He went to Nova and then completed his training at Florida Hospital East, initially the first 2 years as a student and then 3 years of residency in family practice. And today I brought the certificate that shows he's officially certified to be under the D in osteopathic boards for the next 10 years. So he's well on board.
Yeah.
He joined the practice in July last year after he graduated from his residency program, and I want to welcome you to our office and also for his first time lecture to the folks out there. And thank you for coming tonight. Thank you.
Thank you. So thanks, Dad.
Yeah, thank you.
Dr. K, thank you. So today's talk, if you were sleeping, is about men's health and the alternative approach. Men's health gets a lot of press nowadays, and there's all these things out there. I'm sure you go to a website and you click on the wrong link, or you get an email and there's like some sort of weird pill that has all these things in it that'll fix all your problems. So we're going to sort through some of that a little bit later in our lecture. Again, just to review, these are some of our practitioners. We went through them all just now with Dr. K. So definitely, we have a really great integrated team that we have specialty and interest in different aspects of health. So we really are a true bridge to health, hope, and healing for our patients. So what are our goals at CNIM? Our number one goal is to find the root cause of symptoms and disease. Our other thing is that we want to help and support and nurture and help the patient grow. So many times, we're caught up with just treating symptoms, and I've done through this in my whole residency training. So here it's a little bit different, and we are here to help you grow, and we also are here to teach you. Part of being a doctor is being a teacher, and we want to be a partner in your health and educate you and then give you informed decisions. Sometimes Oftentimes you might see a doc and it feels like, they're dictating. Those days are over. Now it's more of a partnership, and like I said, we want to be partners in attaining health. And not just saying attaining health, but I would say more of a road to health, as health is kind of more of a journey as well. And that's the difference between our practice and other practices. We're trying to get optimization versus just a fix. So even patients come to us and say, hey doc, I'm doing really well. I've just got a couple things here and there. I may be on one blood pressure medication. What can I do? We can find room to improve. And health is a spectrum, all the way from disease and imbalance to good health and excellent health. And so our goal is to always get every patient to excellent health, and so we'll be there every step of the way to get you there. And prevention. There's so much that we can do, even now, small little things, diet, exercise, all those sort of things. And we'll kind of cover some of those things as we get a little bit deeper into the topic today. So today's goals of today's talk, we want to first, I want to examine what are the most common causes of death affecting the American male. Let's look at some potential causes for these conditions. Let's look at optimization, and then I'm going to give like a little test patient, a sample patient, who's got some fatigue, some ED issues, low libido, and then find out, okay, what separates us from other docs? What do we do to find our diagnosis? How do we dig and look for things? What are the clues that we're looking at? And then what are our sample plan? What is our intervention? And what can we do to optimize that patient? So that's kind of just a general overview of what we'll be discussing today. So here's a list of the top 10 causes of death. No big surprise. This is actually taken from the U.S. government website. First, we got heart disease. Everyone knows about that. Cancer, unintentional injuries. I'm sure people do silly things. So stroke, COPD, so associated with people who smoke, diabetes, influenza, pneumonia, very common, suicide, kidney disease, and Alzheimer's disease. So, as a general thing, when you're trying to look at what is the general theme, I'm trying to give you a hint here, commonly seen in patients with advancing age. And the ones that we are really more common in those who are advancing age are heart disease, cancer, obviously, stroke, COPD, longer the patient's a smoker and over age, diabetes, kidney disease, Alzheimer's disease. However, age has a double meaning. And for me, it's not just age as in numerical age, but also age as in advanced glycation end products. What does this mean? These are the term advanced glycation end products are the things that are found in all these sort of things, like your fries from McDonald's, the alcohol you consume, the tobacco, anything like pesticides, heavy metals, those sort of things can play a role in increasing your age or advanced glycation end products. So they call it age. What these can do, they can increase your vascular permeability, meaning your vessels can cause damage to your vessels. They can interfere with nitric oxide release, which helps keep your vessels relaxed and open. It can increase your bad cholesterol levels. It can actually affect your immune system by binding to macrophages and all those sort of immune system cells that you have. And basically, it increases oxidative stress. So over time, age is what causes you to age. And that can be accelerated through what you eat, toxins, metals, pesticides, and a whole number of things. So, and it's been implicated actually when you look and you have for example, a patient who is a diabetic patient, when they are measuring your hemoglobin A1C, they are indirectly measuring your age. See, these are a list of all the ages here, and the hemoglobin A1C is just a precursor of that. So what that actually is it is showing the damage of these advanced glycation products. It's giving you a number. So that's already mainstream medicine has started looking at age, but they haven't really implemented a plan to help reduce that or a consolidated plan. And that's kind of what we do here. And like I mentioned, so okay, what can age do? Okay, well, these advanced glycation end products, they can actually damage your DNA. So anytime you damage your DNA, what do we get concerned about? Cancer. Because when you've damaged DNA, now cells grow out of whack. They are uncontrolled. And then also your body has the ability to actually shut cells down and tell them to destroy themselves. But once you've damaged the DNA or have other damage, that whole process gets interrupted. Infections, like I mentioned earlier, if your immune cells have been attacked and damaged, they're not going to be functioning as well. It's like the ambulance. If a tire's been kicked out, you're not going to be able to drive to where you need to go. Damage your alveoli. So the alveoli are the air sacs in your lungs. A COPD patient, they get damage and problems to that alveoli. Over time, leads to COPD. Now, damage to your vessels. Now, everyone looks at, okay, if you smoke, you have these problems for heart attack, or it also increases, problems with stroke. But I like to make it simple. Just look at your vessels. It doesn't matter where the vessel is. If the vessel's in the heart, okay, you have a heart attack if you have problems there. If the vessel's in the brain or in the neck that supplies the brain, if you have damage there, what happens? You get a stroke. You have damage in the penis. What fills your penis up? It's blood. So it's pretty common and pretty simple to think about it this way. Kidney failure also. Kidney it's basically a giant filter, running through all this blood. And so it's very vascular. So damage to the kidney through this age pathway leads to kidney failure. So that's why it's no surprise that a patient who has high blood pressure has kidney failure, or a patient with uncontrolled diabetes has kidney failure. Why do we have to split it all up? We can take a step back, look at the big picture, and see that it all comes together in one unified thing. So 7-step plan. Actually, I changed it. I kind of pared it down so it's a 5-step plan. The other 2 steps, I kind of mushed them together. So let's just keep it at the 5-step plan. So eat, drink, be merry, move, and sleep. Those are kind of the main things that I try and look at. And we're going to go a little bit more in detail in the next slide. So kind of what are the things that you shouldn't be eating? Obviously, fast food, fried foods, a lot of those trans fatty acids, when they actually fry things a lot, that releases all those glycation end products, and now you're consuming that. So you're taking in that poison. Excessive gluten, whey, casein. There's a whole gluten-free kick right now, and there have been a lot of studies showing that it's actually pro-inflammatory. So there's a lot of studies showing that it may potentially be a factor that can increase your age production. Nitrosamines, these are actually found in pickled foods, preserved foods, a lot of the things you find in the freezer section. Sodium nitrate over time can cause increase of age if it sits on the shelf for too long. Now here we're getting into toxins, phthalates, BPA. So phthalates and BPA, we're thinking about plastics, those sort of things that you hear about. Heavy metals and hormones. Hormones are all over in a lot of the foods that we eat. So sometimes, when you're going and getting that fish, we're looking at tilapia, we're looking at Atlantic salmon. Usually those are farm-raised, given hormones or given feed with hormones, so that's something you have to be careful of. Also looking at chicken with hormones. Big predator fish, I'm saying that I'm looking more at mercury. The bigger the fish, the higher on the food chain, the higher the chance that they tend to carry a high mercury load. So those would be swordfish, shark, so no shark fin soup for you guys. And then canned foods, obviously, for the metals and all that sort of stuff. And then excessive red meat has also been shown to sometimes increase that inflammatory cascade from age. So what is good? Okay, that you just listed a bunch of things that I can't have. Wild caught fish is usually a good choice. When you look at your salmon, you want a sockeye salmon. You want on the west coast Alaskan salmon and a wild caught salmon. The chance that they're exposed to a lot of things is less. Though now with the Fukushima thing, now that you can make a case against that. I read actually a study, not to get off topic, they said in the next 10 years we might have an increase of thyroid problems now with that whole mess. to put it lightly. Fresh, organic, hormone-free meats, that's a no-brainer. You go to Publix now, it's pretty common. I've even seen organic meat at Target, so it's getting a lot of traction. And I think the more that we make those choices with our wallets, we can get companies to change because they want our money. So the more that I know initially it's going to be more expensive, but if more people do it, they'll find ways to get it more affordable. And over time, it's going to be something of the past that we had hormone-treated food. Raw vegetable juicing, we're looking at good enzymes, juices, raw foods. Those give you your antioxidants. So think of those are the things that help kind of cancel out your ages. So the things that we're looking at that also have really great nutritional values are things with color. So you're looking at fresh, organically grown vegetables that have color that give you all those antioxidants. It's colorful for a reason. So I'm not saying, dye red number 6 or yellow 11. I'm talking about real natural color. So when you look at those beets and they're so red, that's good. That's really good. Drink. Okay, I'm not talking about alcohol yet. But we're looking at, what are the things that we need to think about? Filtered, bottled versus tap. Some people get obsessed with, okay, well, I got to have 8 glasses because the doc said 8 glasses, but I'm going to the bathroom like a racehorse now. What's going on? Sometimes you can just look at the urine color. If it's like really, really dark all the time, that's just a poor man's test. Try and lighten it up. Have a couple more glasses. You'll notice that it'll lighten up, and that means you're getting enough water. Sometimes if you don't even get enough water, that leads to kidney problems down the road. So that's something that you have to think about. Also, we're looking at next would be ginger, green tea, white tea, rooibos tea, all those sort of teas. White tea actually is one of the better ones, but basically any tea is really good. That has a really good antioxidant these are called flavonoids, these type of antioxidants. The one here is called epigallocatechin gallate. We just call it EGCG. Actually, I was going through some studies a couple of days ago, and no one writes this down because no one could say it. So they just say EGCG, ECG, and even that, I say that 3 times fast. But it's also been shown to be a powerful antioxidant, anti-aging, and there are some people who even take supplements of it. My take on it is that if you have a good source of a tea and you take it naturally, you're going to get a little bit of a benefit. Resveratrol, there's a questionable anti-aging benefit on there. However, there's some controversy more on are you getting enough resveratrol? And 1 glass of wine compared to trying to get a resveratrol found in a pill. If you were to try and do the same amount, you might be taking down 2 or 3 wines or 4. Then you start getting into the problems with alcohol. I'm sure you hear studies, and these are the studies that you always hear, on all the news agencies. They will always say, "Oh yeah, alcohol is great. Now it's time to party." But you got to be careful. 1 drink is good, 2 is not so good, and 3 is kind of basically poison, because all that alcohol does increase and has been shown to increase those age products that we mentioned. But they have been shown that patients who have moderate drink, maybe 1 every other day or 1 a day, they do tend to have less cardiac benefit. They have less cardiac events like heart attacks and those sort of things. So with that, that's a tempered approach, and that depends on each patient. Obviously, a patient who's already had a lot of cardiac disease or has anything like CHF or anything like that, congestive heart failure, then yeah, definitely you would want to cut on the alcohol because it's been known to be cardiotoxic and cause issues to the heart. So it's a case by case basis, and you have to discuss that with your doctor. Be merry. These are the things that I think are no-brainers, and it makes sense. Touching, holding hands, laughing, able to forgive. Those people who hold on to things, it manifests itself in another way. And I can tell you the times that I've been stressed, doing my 24-hour shifts in the hospital, those are when I got sick. I got colds easily. I didn't feel good. And you got to get enough sleep, and you've got to, be positive, because that will help you get better. They also actually showed, they did like a 10-year study, and I couldn't find the study here, but they did a study as they asked these men, does your wife show you her love? And they said, the men answered yes or no. And they actually found that those who answered yes tended to live longer. So what that means exactly, showing the love, well, there's many different interpretations of what that means. But definitely intimacy has shown to decrease the risk for MI if you don't have any other major things on board. And then volunteering, 2 hours a week or maybe an hour here or there a month, that has helped decrease with CAD, which we cardio disease, and depression. So it's not just you're not just a sum of your cells. You're also mind, body, spirit. It all comes in as one. Next part I want to look at is kind of movement. Now there's a question between interval training and long distance training. That's been very heavily debated now. There have been some studies showing that actually when they looked at Olympic athletes, they're looking at those who are marathon runners and those who are sprinters. Actually, sprinters actually tended to do pretty well. There's a question that when you go into excessive long distance running, like marathons and Ironmans and those sort of things, is that during that period of extended exercise, you're really stressing your body. That actually increases the production of age. So, there's that. So now the new research is looking, well, maybe interval training is a better way. So you're doing short bursts of high intensity and then rest. So you're not going through that super, super long stressful period. And then strength training. All men should do a little bit of strength training. It helps keep your muscles good. Also helps keep your lean muscles at a high level. Helps you develop muscle mass. Helps decrease your blood pressure, helps prevent diabetes, brain functioning improves. Even a little bit of exercise, jogging, and those sort of things has been shown to help with depression. So when you're active, you are also releasing what's called endorphins. These are endogenous morphine, basically. Feel-good hormones, and you have the ability to release that yourself. So tap into it, or you can, try something else, but if it's here, your body knows what to do with it. Sometimes something made in a lab, your body doesn't really know how to handle it or detox it. And then it also helps you maintain your weight. And all the studies have shown those men who have a higher BMI or a higher abdominal girth, increased risk for all diseases, diabetes, high blood pressure, everything, all of the above. So this is kind of just a funny picture I wanted to show you guys. It looks like, we started kind of in those days, with the spear, and we're evolving and getting stronger. And now, look, we've got this, we got our big gulp, and now we're having issues. Let's turn that back around and let's get back to Adam and Eve days. Let's get our strength back. Let's get our life back. Let's get our energy and vitality back. And so that's kind of what we need to do. So here's a little sample patient. I just call him patient XY. I don't want to name any names. He's a 55-year-old overweight guy. He's pre-diabetic. He says he has some fatigue throughout the day. It's worse after he eats. He also has some muscle aches and joint pains. He just also can't sleep. He has got chronic back pain. He feels like he's just lost that zest for life. He's irritable all the time, irritable to everyone he knows. His PCP says, yeah, you're probably just depressed. His last time he was intimate with his wife was about 6 months ago. His libido is down, his drive is down, Mr. Johnson's also down. So he tried Levitra. It sometimes works, not all the time. He just feels overstressed. He's been trying some drugs and alcohol to wind down so he can get to sleep. And he's afraid of losing his job as the mayor of Toronto. But I'm not naming any names. So what's our approach with this guy? And it's stuff we just covered. Diet, exercise. Let's examine his med list. Let's see what's there. Let's try and get some insurance-covered labs. There's a lot of labs that your insurance will cover that can give us a big window into what's going on inside. Then there might be some additional testing that we may not do that may not be lab covered. That's just because they're tough tests to do, and they're tough tests for the lab to process, and that's why most insurances don't want to cover it.
And then what's our supplement plan for this guy? And then if we need to, we use prescriptions if we have to. So that's the thing. We're not just a natural clinic. We're natural and integrative. So when we need to, we can pull out the big guns. And then we have to optimize. Basically, everything is health. Then we reassess. Bring them back in about a month, and then we see what else we can do, and then prevent anything else that comes along. So this is why it takes about an hour and a half with our first patient, because we go through everything. Okay, let's look at his medication list. Okay, so he's on Viagra, Levitra, he's tried. He's on Prozac, Zoloft. Okay, so what is one of the side effects of Prozac and Zoloft? I'm sure some people know. Yeah, decreased sex drive. And then also problems getting to orgasm as well. That's another common one. And especially for women, not to get off topic, yeah, that's a big one. Can I get to orgasm? So that's just staring you right in the face. Okay, so now statin drugs. He said, oh, I feel like I have muscle aches and pains all the time, and I've got all these myalgias, muscle aches, that's what myalgias means. Well, there you go. The statin drug, that's the potential cause here. Now he's taking daily aspirin, also taking a lot of NSAIDs. NSAIDs are like your Aleve, Motrin, all that. Well, that could be potentially tearing up his gut and then causing him to have problems getting all his labs and all his vitamins up to par. We absorb a lot of vitamins through our gut, and so sometimes when we interfere with that, like with NSAIDs, which can cause damage to your gut and damage to your small bowel, and Prilosec, which decreases your acid in the stomach, then you're going to have problems. How do you get B12? Why does a patient B12 deficient if B12 is found in all meat products? So you see a patient, he says, yeah, I eat meat all the time. How are you B12 deficient? Guy's been on Prilosec for 12 years. So if your acid's down, you can't absorb. So sometimes you have to think outside the box instead of just throwing another med on board. Testosterone gel. Okay. So his doc started him on testosterone gel. He told me, yeah, I started the testosterone gel. It was doing good for me in the beginning, and then, I don't know, I just started getting breast tenderness, and then my wife started to notice I almost had breasts. Is that common? Yeah. Look on the back of the label. Well, why is that happening? Well, if we just give testosterone and we're not really measuring what's going on, I'll show you a little bit later why. Metoprolol, another big player as far as libido issues. I see all the time, and even during my residency days, patients be like, yeah, I ever got placed on metoprolol or a beta blocker of some sort, and now my libido's in the toilet. Caveat to that is, if you have a history of heart disease and other things, I don't just come in here, okay, and say, okay, stop all this. I want to keep you on what you've been on. If there's a really bad offender, I can stop, definitely. But if you have other diagnoses on board, we have to have a tempered approach. We can't just stop cold turkey, especially with beta blockers, Prolec and Zoloft. You can't just stop cold turkey. You have to think about making sure everyone's on board, and also if you stop these cold turkey, it oftentimes makes your symptoms worse. Prilosec, if you actually look at the Prilosec manual that comes with the prescriber information, there's a big giant white sheet. In small little writing it says should be used for 3 months or less. So that's, I mean, we use it for like 12 years, 10 years. So then you wonder why there's problems. There was another study that mentioned that increased risk of certain types of fractures, and this is more in women, on those that have been on Prilosec, because it plays a role as well with vitamin D, calcium, and all those. So there's a reason. And then hydrocodone, he feels tired and he's in pain, so he's been taking these pain medications from his pain doc. Okay, so what can we do for this guy to at least start off? Okay, let's at least figure out, okay, what's our starting point? Okay, let's look at his thyroid. Okay, so let's check his TSH, that's your thyroid stimulating hormone. Let's check his T4, let's check his T3, let's check his reverse T3. These are all different thyroid hormones and active parts that play a role in your thyroid. Let's look at his thyroid antibodies. Sometimes we don't see any problems in the thyroid, but then we start seeing thyroid antibodies. Thyroid antibodies will tell me, and this is more common in women, that this patient may have a risk to become Hashimoto's or Graves'. Well, why wait until that patient has that disease? If we know the antibodies are there, we can change things, and then hopefully they don't get the full-blown disease. Then we look at your CBC. That's your complete blood count. I want to make sure the patient is not anemic. White blood cell counts are okay. There's no big abnormalities there. CMP, what is that? That checks your glucose, potassium, checks your kidney function, checks your electrolytes. I mean, that's a basic blood work that most docs order. Then also lets me look at your liver function, make sure your liver function is okay, that there's no big problems there. Then CRP, what's CRP? That's C-reactive protein. A lot of cardiologists are ordering this now. It's a marker for inflammation. There have been a lot of patients that have high cholesterols that have no heart attacks, and the CRP is normal. And then there's a lot of patients that have perfect cholesterols, CRP is high, and they have heart attacks. CRP measures inflammation. Inflammation is our enemy. Age causes inflammation, and that's why we're measuring that test. It gives us an idea. You know, is the house on fire? MTHFR, what is this? This is a test which allows us to look at your actual genes. So oftentimes patients, when you are taking any sort of supplement or any sort of vitamin, there is a part of the process that is called methylation. Now, if you have a mutation in one of these genes, you can't properly methylate, or you have problems. And then that could cause a potential backlog. And patients may need different sort of supplements or a pre-methylated form. So that's something that we keep in the back of our mind to kind of realize, okay, this patient's kind of genetically set up for to have some issues. So let's kind of help them on that way. B12, folic acid, B12 and folate, those are common. You know, people are starting B12 supplements all the time now. Iron studies, let's look at your ferritin. Ferritin can sometimes be elevated if there's a infection or other inflammatory disease, so it's sometimes good to get the entire iron studies panel. Vitamin D, this is the big one. You'd be surprised. Everyone says, oh, well, you just get in the sun. We see vitamin D's super, super low, and it plays a role in your immune system, energy, all of the above. Macheski, you saw a patient, what, at 6? 4. And our goals are to try and get you up 40s, 50s, minimum. Pregnenolone, DHEA. These are other hormones kind of on this whole cascade of hormones, and I'm going to show you that on the next test. Then also sometimes we do check blood levels for testosterone and estrogen, but there are other ways we can test it, which are more effective in this particular patient. I'll get into that a bit later. What else do? We do in-office testing as well. We do a vitamin C challenge test. So if the patient absorbs the vitamin C, then that tells us, okay, they have enough vitamin C on board, which is allowing them to absorb our reagent. So we have a special reagent that we do a quick test. And so, you know, what are the things with vitamin C deficiency? We look at malaise, lethargy, patients with a wound healing, gum disease. I mean, you've all seen pictures of pirates. The reason why their teeth is all messed up is because they don't have any of the citrus, and so that's why they call some of these sailors limeys, because they always had the lime with them. That's the little history lesson for you. Zinc challenge test. This is something we do in the office, where if you taste something bad that's good, what we do is we just have a patient swish and spit out the zinc. If they are deficient, they will get no taste. That means that because your body wants to take it in. If the patient has a very strong metallic taste, that means that they have enough zinc on board and that they're doing good. Okay, well, so zinc is one of those interesting little things. It plays a role in almost so many parts of how your body functions. And so it's a coenzyme, it's a cofactor, it helps everywhere. So zinc has been shown, if you have zinc deficiency, you can't properly absorb and use vitamin A and D. It's also needed to help produce your testosterone. So guys, listen up. You know, it's also associated with decreased immunity. So those patients with zinc deficiencies are more prone to have infections and those sort of things. They've also looked at, they did studies in India on childhood viral diarrheas. And those patients were all zinc deficient. And actually one of the things they did to help them, even because it's a viral diarrhea, you can't really treat it with antivirals. By the time you do, it doesn't do anything. And antibiotics don't work because they kill bacteria. So what did they do? They actually gave these kids a little bit of zinc, and that actually helped. And while they're having the diarrhea, they're losing zinc. So you have to help replace it, and then the diarrhea started to improve. Then also low zinc has been shown in cognitive decline. I've heard that there's this form of cognitive decline that we're seeing now. I think it's called Alzheimer's. Nah, I must be reading something else. Anyways, here's some of the tests that we have. One of the great tests that we have available here in our clinic is it's a ZRT hormone panel. And I don't know if you can look on, it might be easier for you to look on your handout. So basically, it allows us, what we have in that particular test, it is actually a saliva test. So we usually have the patient take the kit, and then they go home, and then they choose a day, and they don't take any caffeine that day. And then they spit in this tube about 4 times a day. Now the first part is a little bit bigger, and that allows us to see what are your testosterone levels, what are your estrogen levels, what's the balance there. And it also allows us to see what your cortisol is at that time. Now cortisol is released from your adrenal glands, and it should have a function kind of like a curve near the top and taper out throughout the day. So we have patients a lot of the times who have low cortisol in the mornings, and they say, Doc, I just can't get up in the morning. Well, you know, it's staring you right in the face here now if you do this test. Now traditionally, that whole diagnosis of having low cortisol is considered quote-unquote adrenal fatigue. Now, if you see a regular doctor, they're just going to say, okay, you just have Cushing's or Addison's. There's no middle ground. But as you see and learn about things, health is more of a spectrum, and it's not all go and no stop. There's a middle ground there. And so that's what we can kind of parse out with these labs. And that's what makes it so powerful for us. What else can we do for this guy? We oftentimes do a urine toxic metals test. So what is that? We give you a chelating agent as an IV form, and it actually has an affinity to heavy metals. So what are you looking for here? Aluminum. You're looking for arsenic. You're looking for lead, mercury, nickel, platinum, uranium, tin, all these sort of things. There are a lot of reasons why you would have these metals, but there shouldn't be technically any mercury in your system because it has no biological use. It is a poison. It can cause problems anywhere from fatigue, depression. In some cases, some people have associated with a lot of bipolar disorders and all those sort of things. Now, today we live in the modern era, and we're surrounded by chemicals and metals and fillings and all those sort of things. And so if it's there, it doesn't mean that we have to treat it right away, but that just at least gives us an idea, okay, that's a potential cause that could be kind of lurking that we need to look for. Okay, the next test that we often do, and it's all based on a patient's, the patient's main complaint, and we kind of discuss it with them, is comprehensive stool analysis. So this is what we actually look at, and it's kind of messy. We send you a kit home, and you take a sample, and then you put it and send it out. We give you all the stuff. And what this will do is when it gets to the lab takes it, they analyze it, they look, okay, is there yeast on board? Do you have good bacteria on board? Well, what types of good bacteria on board? How much good bacteria do you have on board? Do you have okay bacteria on board? Do you have bad bacteria on board that needs to be treated? Do you have yeast on board, and what type of yeast is it? Okay, and it also looks at, okay, do you have problems with your digestion? Do you have undigested muscle fibers that are coming down? Do you have undigested plant matter that needs to that should have been digested? This gives us an idea. It's like, do we need to give you some support enzymes to help break this down? It also lets us know, okay, the yeast and the bacteria that's there, what is it susceptible to? Do we need to use, and it actually checks for what type of herbs will work to kill it, or what type of pharmaceuticals will work to kill it. So it gives us a lot of information, and then gives us an idea of where to go. Oftentimes patients, with the IBS or that sort of thing will say, okay, well, I started a probiotic and it didn't seem to help. Well, you're just kind of just guessing at that point. This is all science. It's not that it's, some voodoo thing and I've got a talisman. I'm looking in, it's integrated medicine, and I say, okay, you're going to use this. This is based on science. We're looking, we take it, we see if it grows and figure out what can kill it, and then we use it. And if it's a herbal thing and it'll work, I'll use it. If it's not, then we'll have to use pharmaceuticals. But everything is a tempered approach, and we decide with the patient, and we find out what's best for you. So we don't, we're not stuck to just one paradigm of treatment. We really want to see from all angles and what's the most effective. The next test that we sometimes do is called the SpectraCell micronutrient testing. So this is actually a test from a lab called SpectraCell, and what it actually does is it allows you to see intracellularly what is the health of that cell, what are the deficiencies that you have on board, what sort of antioxidants are you low on, is it vitamin C, is it vitamin D, is it magnesium, or all those sort of things. The problem is when you just order a blood test, it's telling you what's in the blood, not in the cell. So sometimes when you have issues and you're still concerned about vitamin testing, we can sometimes get a lot of good information here. So now we can open it up and see what's exactly in there. So it's a very useful test. So one of the things I also want to leave you with is, man is more than just testosterone. This whole pathway is active in all people. We've got cholesterol, pregnenolone, progesterone. So pregnenolone was one of those regular lab tests that we can order through your insurance. And that gives us an idea of what's going upstream. So that's kind of, as Dr. Macheski call it, what, the master hormone? Yeah, he's saying yes. And then we look at, okay, what are the things that we need to fix? So if we are looking at your pregnenolone levels, we're looking at your DHEA levels. I'm ordering an estradiol, that's the most potent estrogen. I'm looking at your cortisols. I'm looking at all these things. It gives me a whole window. Okay, now I can see, okay, you got too much estrogen, or you got too many things. Okay, if you have too much estrogen, what do we need to do? There are a couple of things we can do. We can use chrysin, which is a natural aromatase inhibitor, or we can use Arimidex, which is a pharmaceutical grade. So now if you look real closely, I don't know if you can see it here, but right where it says androstenedione, right there it says aromatase, and then testosterone to estradiol, that's also aromatase. So your testosterone gets converted to estrogen, guys. So if your doc keeps upping your testosterone, you're going to get man boobs, for lack of a better term, or it's gynecomastia. There is a better term, but we use gynecomastia clinically. That's going to happen if we overdo it. So you have to have a tempered approach, and you have to know that, okay, if I keep throwing something on this path, you have to know that, okay, it's going to shift and convert down here. So you're wondering, okay, well, where does this happen? This happens in the fat. So the bigger your patient is, the more aromatase they have on board, because this is happening in your fat. So if the guy is already pretty big and you start giving too much testosterone, you have to be careful, because you're going to get too much estradiol, and then it's going to just spin around in circles, and you're going to be in trouble. And then we have to look. Yeah, does the patient have low? Does the patient have low pregnenolone? Zinc deficiency, yes. Zinc deficiency, like I stated earlier, plays a role with your testosterone and how you make it. The next thing is that, okay, what's another way that we can affect your testosterone? So this is kind of basic biochem, at least like I did in school. And this is every doctor learns this in school. And then once you graduate, then you said, okay, the only thing that matters is testosterone. Well, okay, you got your hypothalamus, sits right here, releases gonadotropin-releasing hormone, which talks to your pituitary. Your pituitary then releases your FSH and LH. Those are two different hormones that help tell the testes what to do. So the FSH goes to the Sertoli cell. That's the name of the cells. The guy named Sertoli probably discovered it. And it tells you, okay, let's mature the sperm. And the Leydig cells help get your testosterone. Okay, what are these little arrows here on the back say? Okay, so if I increase your testosterone, what this says is testosterone, your body is very smart. It has all these gauges and checks and balances built in. If you increase your testosterone, it's going to inhibit your pituitary, so you release less FSH, less LH, and also inhibits your hypothalamus. So you also release less gonadotropin releasing hormone. What does this mean? this explains why if you overdo the testosterone, one of the other most common side effects is shrinking of the testicles. So there are so many things that we can do, but if we just focus on only one thing, we're going to be out of balance. And this is a great example, and you can you talk to a doctor about this, they learned this, they just don't apply it. And that's kind of the difference, with our approach here. So what can we do? Clomid. What's Clomid? I thought, this is for women who want to get pregnant. Well, it actually has been shown to indirectly increase FSH and LH. Now, why do we would want to do that? Well, because we know if we increase those, your testosterone is going to go up. Your sperm count is going to go up. If you see infertility specialist on the guy side, he sometimes uses Clomid. We can use it in some patients, and it works. The thing is with our young patients, it's probably a better idea, because if you're a young guy and you haven't started your family and your doc puts you on testosterone, guess what? You're basically sterile, because your sperm counts will go down. So you need to think about that before starting testosterone therapy. And actually, there's been studies in Europe where they're actually looking on giving testosterone to guys as a form of birth control. So and it works. It works great once you get them at a certain level. So, you just have to just go back to the basics that we learned in med school, and then it's all sitting there right in front of you. Thyroid. Here's another great example. Okay, so thyroid. What makes your thyroid? What's one of the great components of your thyroid? Iodine. Well, okay, let's look and see. Do you have iodine deficiency? Is iodine low? Sometimes it is. We need to think about it. Okay, is your reverse T3 high? What is reverse T3? It is a hormone that helps it's kind of interrupting the regular function of your T3, for lack of a better explanation. What can we do to approach that? There are certain strategies and supplements we can do to help drive that number down, get your thyroid working better. Okay, well, what else is happening with your thyroid? Your thyroid just doesn't release just T4. Now, T4 is your synthroid, what do you get at the stores? There's tons of women on it, and a lot of guys are on it as well. But there's also T3 that plays a role as well. So we got to think about, okay, do you need Armour thyroid? Do you need a thyroid supplement that gives you both T4 and T3? Well, it depends. In some cases, I've seen the endocrinologist, and sometimes here we use differing doses, and then we'll use, okay, you just need a little bit of T3. The caution and the reason why your regular primary doc won't write for T3 is that if you overdo this, patients will go into arrhythmias and all those sort of things. So it has to be a tempered approach. It has to be balanced, because if you just go in there guns blazing, it's not going to look good. So this just gives you an idea that, just measuring TSH, yeah, it gives you an idea basically of what's happening with the thyroid. But if that patient is still having hypothyroid symptoms, you need to dig a little bit deeper and look a little bit better, because you could be missing something huge. Here's a little just list of stuff. I call them gas station supplements. I'm sure when you go there and you behind the counter next to the cigarettes and the condoms, and you see all these things and these fun time pills. The thing is, you're getting it from a gas station. It's from a gas station. You don't know what's in there. And there's a lot of issues that a lot of these can be powerful. Ginseng can cause high blood pressure. L-arginine, if you mixing, this is a precursor that helps with a vasodilator, which is nitric oxide. It helps loosen the smooth muscles around your vessels, so help kind of open up so you theoretically get more blood flow. Okay, that might work, but if it's not done right, if the patient has a history of high blood pressure, or has a history of arrhythmias, meaning abnormal heart rhythm, or has a history of low BP, you could really mess some things up. And, the question is quality. Do you trust them there at the gas station? I don't. So sometimes you got to look at, where you're getting your stuff from, and who's the manufacturer. Here in our office, and, the supplements that we get are from big, well-studied reliable pharmaceutical companies and nutraceutical companies that do extensive testing, and also third-party testing, meaning someone else tests and see, okay, this is what you have in there. I don't think Extends and all those other ones do the same sort of research. And the other thing is that they throw in like, okay, well, this one might help and this one might help. Let's just put all of them in and then give them in a pill and see what happens. So that's something that I always tell guys, you know, just be careful. I had a patient the other day who was trying something like this, and then blood pressure shot up. And he said, well, what did it? I guess it's this, but and then he asked me, well, which one is it? It was like, well, it just depends on how that batch was and how they did it. So that's something that you have to keep in mind. And, you know, sometimes, you know, you could use these things, but again, tempered approach. And also, it's not just a quick fix. There's so many other aspects that we have to look at, that if we get those balanced first, then maybe we can kind of push you in the right direction with other supplements. So, you know, I don't want to get too involved. So what's the take home today? Diet, exercise, you've heard it before. Lifestyle, okay, age. And then also look at what are your ages. And then hormones, it's not just testosterone. I just showed you that. And TSH for thyroid may not be enough. See if you need to get more labs. And then the other thing, I may not have touched this much, labs that are reference range may not be okay for you. So if you're still having symptoms and your labs are within normal limits, well, that means you just need to dig a little bit deeper. Oftentimes, you know, in a 15-minute visit, it's easier for a doctor to say, okay, well, you're just crazy then. I mean, that makes him get through his day because he's already thinking about not the next patient, but the patient after that. So, you know, sometimes when the labs that are okay, quote-unquote normal, you need to dig a bit deeper, especially if the patient's still having symptoms. And then, you know, today's lecture just shows you that our approach isn't, you know, crazy, that I'm, you know, in some cases, yeah, we'll use some herbs, but a lot of it is just simple science. And I think it's just, this is science to the next level. You know, we're doing more testing, we're finding out more, and we're really getting good results. So it's not just natural medicine, but it's also an integrative approach. And that's what I want to stress today, is that we're natural and integrative. And yeah, that's it. Any questions? Well, okay. I think everyone wants to, oh yeah, right on time, 7 o'clock. All right, that's great. Well, I'll be around for a little bit. If there's any like personal questions or something. Obviously, since say, you know, we're not, you know, it's just can't give like detailed advice. But yeah, definitely call the office. You'll probably talk to Angel or Nalita, who's our patient care coordinator, and they'll set you up. And you know, you can see myself, Dr. Kehoe, Macheski, and we can really help in so many ways. So we're here as a resource, and we give talks every month here at our office. Next month's talk's going to be, like Dr. K mentioned, by Dr. Romy Mushtaq, and it's about mindful living, I believe. Yes, stress, yeah, how stress can kill you, which actually is pretty good. I mean, I think it's going to be a good lecture. Okay. Well, I hope you enjoyed, you know, and just please fill out your comment cards. Let us know how we did today, and I hope to see you guys next month. All right. Take care.
Thank you.
Thank you.
On every Wednesday, we do have the yoga sessions as well.
Yeah.
And as I said, this will be available
and Monday.
And Monday as well. Yeah. So we are starting a new series of yoga practitioners. You know, the ones on Monday will be by invitation, so it will be for patients who are on board, and if you'd like to attend it, ask one of our practitioners so that we can do the referral in-house. On Wednesday, it's open to everybody. Okay. Thanks again. Any other questions regarding the office at all? Or any other?
And Bruni is available for.
But I appreciate it, and it was an excellent discussion on. You know, we do get sometimes so stuck on one area. But I think overall it's great, you know, take home in terms of, okay, where do we take things for now. Appreciate you all coming, and we'll see you guys next month. Thank you.
Thank you.
Thank you for joining us this time on our talk on men's health and wellness. And remember that men's health is more than just testosterone. If you enjoyed this talk and you want more information, please contact our office at 407-355-9246. And our upcoming next lecture will be presented by Dr. Romy, who will be giving a talk on mind-body medicine.
For more information on this subject and other DVDs available from the Center for Natural and Integrative Medicine, contact us weekdays during normal business hours at 407-355-9246. 407-355-9246.